Have you ever wondered if your vaginal discharge is normal, or worried about a bump you found? Or maybe you've noticed a smell and thought, is this okay? Well, you're not alone. I'm Dr. Shevon Joseph, and in today's episode of You Are Stuck About, we're talking about vaginal discharge, bumps, and odors. What's normal, what's not, when to see a provider. Let's take the awkwardness out of this and get you the info you deserve. This is for informational purposes only. For medical advice or diagnosis, consult a professional. So what exactly is the vulva? The vulva is the name for the external or outer parts of the female genital area. The part you can see on the outside is the vulva. So that includes the mons pubis, which is the soft mound of tissue above the pubic bone, often covered with pubic hair. Then you have your labia majora, the larger outer folds of skin. The labia minora are the smaller inner folds of skin. The clitoris, which is a sensitive organ involved in sexual pleasure. The urethral opening, where the urine comes out. The vaginal opening, which is the entrance to the vagina. And then you have the perineum, which is the area of skin between the vagina or the vaginal opening and the anus. The vagina is not the same as the vulva, right? The vagina is the internal canal, while the vulva is everything on the outside. So I hope that is a good framework to start today's discussion. So vaginal discharge, what's normal versus what's not? What is vaginal discharge? Vaginal discharge is a clear or whitish fluid that comes out of your vagina. Discharge is normal. I cannot express this enough. Discharge is normal and it plays a protective role. But changes in the amount of discharge, the consistency, the odor or smell could indicate an infection or some other problem. Normal changes occur across the menstrual cycle. Clear, stretchy discharge indicates ovulation. White discharge is usually the luteal phase or the window of time after you ovulate. And discharge can become slightly yellow when dried, which is normal. Okay? When it's not normal is when you have gray, green, or yellow changes, frothy discharge, very thick with clumps, a strong smell or odor, and also any itching or burning. So those are not normal. Vaginal discharge is like a report card from your body. So it changes with your cycle and your hormones. But if the color, consistency, or smell is suddenly off, it might be time to get a checkup. Bumps, lumps, and sores. Here's a breakdown of what's normal and what's not normal. So for the vaginal area, normal changes includes Fordyce spots, which I'll talk about a bit, ingrown hairs, and skin tags. So those are considered normal. No need to freak out for those. What's not always normal, and reasons to see your doctor, are when you have painful or grouped blisters, which can indicate possible herpes infections, Bartholin cysts, ulcers or open sores of any kind, and genital warts. So what are Fordyce spots? Fordyce spots are tiny, harmless bumps that are made up of oil glands that sit in places where you wouldn't usually find them, like the lips, inside the mouth, or on the genitalia. They are not linked to hair follicles. This isn't an infection, and they aren't contagious. Normally, oil glands are lined up right next to our hair follicles. Sort of picture like a house with a garage. With Fordyce spots, these garages or the oil glands are not built in usual places. Like it's just a random garage in the middle of a park or on a sidewalk. So the lips, inside the mouth, and the genitals are not attached to houses, which would be the hair follicles. So they're just these little quirky little nodules or growths that are in unexpected places, but they're completely harmless and are not caused by infection. So who gets Fordyce spots? Fordyce spots are present in over 80% of adults. They're probably present from birth and become bigger or more visible over time. And usually there's a connection where they might sprout up during puberty. Fordyce spots are not a sexually transmitted disease and they are not infectious. The clinical features, the spots are usually very small, 1 to 5 millimeters, slightly elevated, yellowish or whitish kind of appearance to them, little papules as we call them, and they can appear on the inside of your cheeks and also what's called the vermilion border of your lips. They can appear on the glands on the shaft of the penis, and that's when they're referred to as Tyson's glands, or they occur in the vulva and vagina of the female. The Tyson's glands, which are in the penis, are modified oil glands or sebaceous glands located on the inner surface of the foreskin of the penis near the frenulum in males. I was looking for pictures to describe this, but I chose to keep it strictly to the vagina. But sometimes you see these on a sexual partner and you'd be concerned as to whether or not this is a sexual infection you can actually transmit, but it's not sexually transmitted. They are a normal anatomical variant, but in some cases they could secrete a substance which is referred to as smegma. And smegma is a cheesy substance which is composed of skin oils, dead skin cells, and moisture. So in some cases, this can become inflamed or infected in men. When they occur in the areola of the breast, the Fordyce spots are referred to as Montgomery glands. And these can occur as a solitary one. You may have one solitary lesion on the areola, but more frequently, it's in crops of up to 50 to 100 of them on the areola. They're easier to see when the skin is stretched. How are Fordyce spots diagnosed? Fordyce spots are usually just a clinical visualization to be diagnosed. They very rarely require a skin biopsy for histological examination. And if it was biopsy, they would just show a sebaceous gland that was just under the surface of the epithelium, and it's not directly connected or associated with a hair follicle. So it's important to recognize that these are benign changes and also to understand the differential if there's an STI or not, because sometimes some STIs could start off looking like a Fordyce spot, depending, but it's important to understand that the Fordyce spots are benign. They're harmless, they don't require any treatment. Avoid picking them, don't squeeze them, don't tweeze them, just leave them alone. They can be a cause for cosmetic concern for some patients, however, and that's when you seek professional help. Some procedures like electrosurgery or vaporizing them can be done with like carbon dioxide laser treatments and so forth to successfully remove these spots. Ingrown hair is the next. So let's talk about one of the most common and least dangerous causes of bumps in the vaginal area, which are ingrown hairs. These happen when a hair grows back into the skin. So it grows back into the skin instead of growing out through the surface of the skin. They usually show up as small red or dark bumps, sometimes with a visible hair trapped on the inside. You'll often see them after shaving, waxing, or tight clothing rubbing on the area. They could be a bit tender, but they're not dangerous. The key, don't pick or squeeze them. Instead, apply a warm compress, wear loose clothing, loose cotton underwear, and also exfoliate gently. If it's painful, swollen, or it looks infected, it's okay to see your doctor or provider because you may need a topical antibiotic or topical cream of some kind for the area to heal. And fast facts here. Ingrown hair versus STI. Right, so ingrown hair, usually a single bump, usually has a hair kind of stuck inside and you may have mild pain. STIs, on the other hand, which let's say, for example, herpes, it's often multiple painful blisters with open sores. So that's the main difference there if you want to kind of have a quick gauge of what's the difference between the two. Folliculitis which is a local infection of the hair follicle, can happen in the vulva, where the vulva hair is affected by bacteria, and this happens after shaving, waxing, or even friction on the area. It's inflammation of the skin surrounding the hair follicle with erythema or redness. As you can see, I'm showing there's folliculitis where the skin has this redness, this red appearance, and it's the inflammation of the skin surrounding the follicle, and there's redness with elevation and some painful areas as well too involved in the skin. And this treatment usually requires a topical antibiotic, and in some more advanced cases, more widespread cases, such as this one, you would need some form of an oral antibiotic. Because here you can see the skin is inflamed, the skin surrounding the follicle is in red and erythematous, as we call it, the skin is elevated. There's inflammation trapped in below there as well within the hair root, and this could be quite painful. Next, we have hidradenitis suppurativa, or HS. Hidradenitis suppurativa, HS is what I'm going to call it. It's a skin condition that affects the vulva and other parts of the skin. The pimple-like bumps develop when there's chronic inflammation of the apocrine or sweat and sebaceous or oil glands. So you have the sweat glands and the oil glands, and those become inflamed, and subsequently they get infected by bacteria. And this could be pretty alarming, and it's very chronic. So it starts as a nodule of inflammation or these firm lumps under the skin that evolve into an abscess due to bacterial superinfection, and then they rupture. And then they form what's called a fistula. A fistula is an abnormal tunnel-like connection between two body parts that aren't normally supposed to be connected. Fistulas usually form because of an infection, inflammation, injury to the area, and the tissues become damaged. It can connect, even organs can form fistula, like bowel to bladder, or organ to skin, like bowel to skin. One other example outside of this would be fistula formation with Crohn's disease, for example. In HS, because it's such a chronic and very advanced or deep damage to the area, early diagnosis and treatment could prevent HS from worsening, even if we don't know how to stop it from happening in the first place. Early and long-term treatment may help control the pain that happens with HS and also promote wound healing, and can keep new lumps from reforming and prevent complications. The treatment is surgical because often you need to have drainage of the areas, and also antibiotic treatment, and sometimes systemic, local and systemic antibiotics, depending on how severe the infection is. It can happen in the armpit, which also, again, can be quite painful. There's a lot of drainage or this recurring infection to the area. So getting it treated is very important. As I go through these slides, these are other areas. It can happen in the armpit, as I mentioned, the mons labia, in between the breast area and under the breast area. This can happen as well too, and the inner thigh folds in the groin area can be quite extensive. Next, we have skin tags. So if you didn't know, a skin tag is another bump that can show up on the vulva or groin area. These are small, soft, usually skin-colored, fleshy flaps that kind of hang off the surface of the skin, usually by a little tiny stalk sometimes, or they might be a bit more flat attachment, but they're completely benign. They're not dangerous, and they often show up in areas where there's some form of friction or folds, like around the neck, the armpit, the groin, the inner thighs, or under the labia as well too. They're more common with age, during pregnancy, in people with a higher body weight, and also is a symptom of insulin resistance. Unless they're growing or bleeding or bothering you in some way, there's no need to remove them. But if you're unsure whether or not it's a bump that you should be concerned about, it's perfectly okay to get it checked. Some fast facts again. Skin tags versus genital warts. Skin tags, they're smooth, they're soft, and they tend to hang off the skin. Genital warts are often rough with a bumpy surface. Skin tags, they usually don't multiply or spread rapidly. Genital warts will spread or grow in these clusters. Skin tags do not have any link to HPV. They're not caused by HPV. Genital warts are caused by HPV. So that's all I wanted to point out about skin tags. And this is a great point to pause the video, because I am going to now segue into other conditions about the vagina. So this will be part 1. But stay tuned, part 2 will be shortly following, and we're going to definitely continue to highlight the things you need to know about vaginal lumps, bumps, and odors and discharge. So see you in part 2. If you need some help with your decision process, feel free to book an online consultation with me. It's quite easy to do so via our website. You'll find all of our information linked in the description below. Looking forward to chatting with you. Take care.